Okay, this is front cephalic urinary IV catheter. I have assembled a tray of supplies. Got my catheter here that I've already flushed with my flush here, and I've got my T-set here ready with my flush that I've already primed. Got alcohol, Chlorhex scrub, and I've got my materials here for a bandage. And then I've got bandage scissors. And then off to the side here I have my tape prepared, ready. So let's go get our clippers right here. Okay, clippers work. Alright, now we are all ready for our dog. Okay, we have our patient here, and we have wrapped the leg and shaved our area for our catheter. So what we're going to do is scrub with our Chlorhex and our alcohol. And we're going to do 3 scrubs of each. Okay. Now we've already pre-flushed our catheter, so I'm going to make sure that my bevel is up as I enter the vein. And I've got a good flash of blood. I'm going to insert my catheter and plug. Catheter. Alright, now I've got my tape here. Making sure that I cover the insertion site of the catheter that goes into the skin with my tape. When we tape, we want to make sure and not bend the catheter up so that it gets kinked in the process of the taping. Got too much tape here. Pull some of that off. Just a little tape. Okay. Then what we're going to do is, oops, getting ahead of myself. Got our T-port here. Alright, we inserted our T-port. We're going to make sure that our catheter flushes. And it does. And our T-port, and we're going to tape our T-port in. And then tape our line down so it doesn't get kinked. Okay, now we're finished, and what we're going to do is place a cover of vet wrap to protect our catheter. And then pull off this down here. Okay, there's our catheter. Alright, we're going to talk about some things with an IV catheter. First of all, we're going to talk about complications. Some things that can happen with an IV catheter is you can have, first, hematoma, or you can blow the catheter, or blow the vein actually putting the catheter in. Then you can have thrombus or blood clot. Then some other things that can happen are infection or phlebitis. You can irritate the vein and the area around the vein. So aseptic technique is super uber important to prevent some of these things. Some things to prevent hematomas would be make a pilot hole. If you know that you're going into a thick-skinned animal, make a pilot hole. You can bury your catheter real easily, trying to get through your skin and then into your vein, and create a lot of problems that way. Aseptic technique. Make sure that the skin is clean before you insert your catheter. If you're on your third scrub and you're still wiping dirt off, if your third scrub doesn't come off clean, you may need to do more than 3 scrubs. Scrub until the skin is clean, until your scrub sponges come off clean, just like as in a surgery. The catheter needs to stay in for quite a long time, and we're going to need this vein for quite a long time. So take care of it. Treat it like it's something special, because it really is. This could be a life-saving measure for an animal. Complications really could be thrombus, blood clots, hematomas, or blowing your vein up, phlebitis, irritation, and then introducing infection. Some things when you're thinking about maintenance on an IV catheter. First of all, tape correctly. If your tape is all messed up and not neat and tidy, could cause an issue. Your tape may get too tight. If you are putting a catheter in an extremely dehydrated dog, and then over the next few hours you dump tons of fluid into this dog, he's going to swell. So the leg's going to swell. So then the correct taping that you might have done for the dehydrated dog is now incorrect for your now hydrated dog or cat. So you may need to retape after a few hours because your tape will be too tight. You need to be looking at this catheter at least every 4 hours, if not longer, if not shorter than that. Catheter should not stay in any longer than 72 hours or 3 days. Look at your catheter every 4 hours at least, and it needs to be flushed if it's not in use. And so make sure that your catheter is still patent, it's still flushing. Check around the area. If the skin is red, you want to check for swelling. You want to check for heat or pain. And then discharge. I've seen tape create hot spots that when pulled off, you have this huge inflamed hot spot area on the skin. So now you have another open wound you have to heal. If your dog or cat is messing with the catheter constantly, there could be something wrong with it. So check it frequently, flush it frequently, and your flush doesn't always have to be with saline and heparin. If the catheter is not in use, it's a good idea to use heparin just to prevent a blood clot inside that catheter. But some drugs may react with heparin. So to be safe, if you're going to be injecting a drug into your catheter, flush with straight saline, inject your drug, and then flush with straight saline again. And then if the catheter is not in use, or you need to really be diligent about maintaining it, use your heparin with saline to flush that catheter routinely to prevent any blood clots in that catheter. So you also need to pay attention to your paw distal to the catheter. And then if you have a jugular catheter, you need to pay attention to any swelling above or below. One important fact when placing a jugular catheter is you always place it pointing down. You never place your catheter pointing up. You want all that fluid to go down and not into the head. So watch for swelling. If your paw is swelling, then your tape may be too tight, or your bandage may be too tight. Just general precautions to look, general nursing diligence is the most important thing, and paying attention to details. I really pay attention to behavior on the animal. Some animals are just nitpicky about anything being on their feet, but most animals in the hospital are so stressed out anyway that they're going to tolerate a lot of things being done to them. So if they're messing with it a lot, something's wrong. If they're not messing with it, doesn't mean I can't check it, doesn't mean I should leave it alone, but it means that it may be okay, and just a general overlook would be fine. Check your tape, check your skin around the tape, check for swelling, flush your catheter, and keep vet wrap and bandages around it to minimize soiling along the tape. Also, if your tape gets wet, it needs to be retaped. Wetness and moisture is going to create a great environment for bacteria and infection to start. So what I like to do here at this clinic is put a modified Robert Jones bandage around my IV catheters. So you place your catheter, put a layer of stretch gauze, a layer of cast padding, and then your vet wrap. Always leaving your ports open, so if you need to inject, then you have an open access in that port. But it protects your tape, and it also provides some compression in protecting against swelling in the paw. So you want to look at your paw too. Make sure your paw's not swelling. So I like that bandage because, especially on little cats, I start down at the tiptoes and go up to just above the catheter. Something else to watch and maintain, but it also helps protect the leg and maintain that tape. So ways you can help your patient not chew on your catheter. You have a couple things right here. The e-collar. When you're sizing an e-collar, you want to make sure that your patient's nose does not go past the edge of the e-collar, or that he can't push it and slide it down his neck and get his nose past and chew on his leg. So anyway, e-collars are great. We have at this clinic no chew vet wrap, which is really cool. It has a chemical in there that tastes really bad, and I know, I've tried it. Weird, but you get it on your hands and it stays for a while. So it's a great thing. I love this no chew wrap, especially on little puppies. It really, if they get a good mouthful of it, it's to really deter them. Not all the time, which is why you have your e-collar, but the no chew wrap is really neat. My favorite actually is these swivel, I don't know if you can see, but it's got a loopy-loop IV set in there, and what happens is usually use it in conjunction with an e-collar, and you attach everything, and it goes up the body, up the arm, attaches to the e-collar here, and then hangs above their head on a spring system. So it gets everything behind and out of the way, and the dog or cat can't see it, can't mess with it. They're less likely to chew on it. So I really like the swivel catheters, the swivel IV lines, especially for the hyperactive dogs that are spinning in their kennels and twisting their lines anyway. So also pay attention to your tape job when you're thinking about preventing your animal from chewing the catheter. If your tape is wrinkled or not on the skin flat, it's going to create irritation. If you've bunched the skin up by mistake, or if it's stretched too tight over the skin. So really pay attention to your tape job when you're thinking about preventing your animal from chewing. Nice and slow and methodical is the way I like to say it is, because if you rush through it, you're more likely to make a mistake and create a problem later on down the road. So we've kind of already talked about heparin, 1 unit per milliliter of saline. So anyway, there's some complications, maintenance, and some ideas on how to prevent chewing on a catheter.